Good morning, everyone. Thank you for joining the webinar. Let me start with the housekeeping role. I would like to request all of you to switch off your videos and keep your mics on mute. Uh, I kindly request you to type in your questions in the chat box so we can discuss on those after the webinar. Please change your chat setting to all panelists and attendees so your questions can be answered later. If you have any very specific questions, please email us on office313@gmail.com. And the webinar link will be available from 9 a.m. to 9:45 a.m. to join in. No late attendees will be entertained thereafter. Each attendee should have been attended till the end of the webinar to obtain the certificate for CPD points, and the CPD points are strictly adhered to the NCCPD guidelines. This is to improve and maintain the standards of the CPD programs conducted by Sri. Thanking you for your strict adherence of the CPD regulations and your kind compliance. So I hope all of you will enjoy this webinar and find it very useful for your clinical practice. Without any further delay, I would like to welcome our lecturer for this webinar session, Professor Miyuru Chandradasa, Consultant Child and Adolescent Psychiatrist attached to Colombo North Teaching Hospital, Ragama, and Professor in Department of Psychiatry at University of Kelaniya. He previously worked as a senior honorary lecturer at Monash University in Australia. He has obtained child psychotherapy training from University of Melbourne. He is the first board-certified child and adolescent psychiatrist affiliated with the University of Kelaniya. He has won National Research Council, Senate, and Vice Chancellor Awards for his research on child mental health in Sri Lanka. Prof. Chandradasa has published 86 articles in peer-reviewed international and local journals over the last 6 years. He is the president of the Sri Lanka College of Child and Adolescent Psychiatrists. Over to you, sir.
Right. Today we are going to discuss about parenting because I think this is a very important topic. For example, you must be remembering that while you were a medical student, you learned about schizophrenia, bipolar. So schizophrenia, 1% of the population. Bipolar, 1 to 2%, maybe 4.5 when you consider the bipolar spectrum. However, parenting is for every patient you see. Let's say you see a patient with chronic renal failure. Remember, that patient has 2 kids back at home. You have to look out their well-being as well. Let's say you see a patient with a myocardial infarction. Remember, there's a little kid near the bed looking at his father crunching to his chest, scared. So parenting is important for all patients. I think this is the most important lecture in psychiatry that the medical student should have. So you are more than welcome to ask any questions and send your questions over the chat. So I'm going to discuss 3 case examples whom I have recently seen. I have changed the details so the patients will not be recognized. So I expect you to give your opinion, ask questions when I post the case history. So when I post the case history, please send your opinion through Zoom chat so we can proceed with the discussion. So the case example 1, I want you to read the case example and send your opinion about what are the reasons, what we should do, and anything you want to know from me about this case. So please read and respond via Zoom chat. Okay, what do you think? Can you please type your opinion and send through Zoom chat so we can proceed? What do you think? What is causing this headache and why is she scared? Okay, we have the first response. Is she seeking attention? Yes, good question. So, lonely little girl, neglect, possible uncomfortable environment at school. Yes, very important. Possibility of separation anxiety. Yes. Busy parents. Both parents are working, and the reason could be that the both parents are busy. We need to exclude bullying, and we need to look whether there is poor parenting. And another comment, poor parenting, she has been brought up with too much care, no independence. Good. Possible anxiety is going on, attention seeking, problem with the teacher's response. Another comment is maybe frightened of the teacher. Very valuable comment. Thank you. Also, another comment, new environment and poor social interaction. And lack of family time to discuss any matter as class, must be having a small kid at home. So maybe there's another younger sibling and this may be related to sibling rival. Another comment is possibility of trouble with friends. Okay, a lot of responses saying it could be attention seeking. Another comment, some hidden mental trauma. Right. Thank you. Very valuable comments. All are possibilities. Okay. Let's look at this history. Sehansa is a 7-year-old girl studying in grade 2. 7 years old. So we know, according to Piaget, the cognitive stages of children are divided into 4 stages. 0 to 2, the sensory motor stage, where children see the world through sensations. They like to hold hands, cuddle to their mother, play with their father, ride on their back. And 2 to 7, the pre-operational stage, where the full logical reasoning is not yet developed. හරියටම තර්කානුකූලව ලෝකෙ දකින්න අමාරුයි. Still, they understand and pick role models from teachers and parents. They look at adults and think what they are doing and learn from their behavior. So she's studying in grade 2, not grade 1. She's not new to this school. She has already spent 1 year at school and this is grade 2. So she is used to the same teacher because grade 1 and 2, it's the same teacher. She refuses to come to school on some days. So she has some school refusal. Still she comes, but there's some reluctance on school days. So school refusal is one of the commonest presentations to a doctor. When she arrives, she does her work very neatly. Focus on the work very neatly. A grade 2 child is not usually very neat. They can be neat sometimes, but when you are 7, you are not supposed to be neat. You are supposed to make mistakes, erase, color, scribble here and there, make writing errors, spelling mistakes. You are not supposed to be neat when you are 7. So she is very neat. So there's an element of perfectionism in her schoolwork. It doesn't mean she will be perfect in cleaning her room or eating all her rice, but she is perfect in her schoolwork. Does not play and interact much. She is reluctant to initiate a conversation and is not a conversation starter. So she is somewhat timid, shy, and is not very good at building friendships at the beginning. At school, at times, she complains of headaches and is sent to the sick room at school. So, frontal headache, nagging type of frontal headache, which is vague at times, is characteristic of stress in a 7-year-old. So, what happens when you are stressed? Adrenaline, cortisol is released, which tightens the muscles around the head or the skull, giving rise to headache, which tightens the muscle in the upper abdomen, giving rise to abdominal pain. That is why anxious kids on school morning say, "Bada ridanawa, oluwa ridanawa." Right? So this is a common complaint of stress. Both her parents are doctors, and always one of them stays near the school to support her if necessary. And both parents leave their work, they are doing essential work and staying near school to support her. That shows emotional over-involvement. This is not a stroke, this is not a seizure, this is just a headache, which has been seen by 2 specialists already. Still, the parents are staying near the school gate to support her in case she needs help. So this shows anxiety from the parents and emotional over-involvement. You have headache, we have shown to you the specialist. Specialist said nothing wrong. Okay, it's your problem. We don't have to leave our work and stay near the gate. That it shows clear over-enmeshment. Enmeshment means parents are too emotionally attached to the child and they think relieving child's headache is their responsibility. Two pediatric neurologists have seen Sehans and all investigations are normal. The highest possible specialists, not one, two have seen. Now, you know, in UK or pediatrician, UK or Australia, this kind of a headache will never be seen by expert. It will be at the GP level, and to go to expert level, it will take a lot of time. So here already two supra specialists, pediatric neurologists have seen and said there's nothing wrong with your kid physically. However, the parents are still anxious and they still want to seek further opinion by going to a third pediatric neurologist. So this shows the parents' anxiety, worrying nature. And at home, Sehansa's maternal grandmother advised her mother to keep Sehansa at home until her headache improves. Where does this anxiety or emotional over-involvement transmit from? From the grandparents itself. So the maternal grandmother has raised her daughter, who's a doctor today, in an emotionally over-involved environment, and now she's raising her own daughter in a similar environment. Still, the maternal grandmother holds power and saying, ඔළුව එකක්කම හොඳටම හොඳ වෙනකම් මේ බබාව ඉස්කෝලේ යවන්න එපා. So this is what we call classical permissive parenting, which is very damaging to kids. What is permissive parenting? Where you don't keep clear emotional boundaries between you and your child, and you are too emotionally over-involved and you give in to their commands. Let's see where permissive parenting is seen in this example. First, the teacher. Teacher does the worst thing possible. When the child has headache, the teacher sends the child to the sick room. That is a reinforcement. ඔළුව කැක්කුමයිද බබාට sick room යන්න. Then now the ඔළුව කැක්කුම, the headache has allowed her to remove herself from the anxious environment in the classroom and stay in the sick room nicely. So her anxiety provoking behavior or her headache related to anxiety has allowed her to just creep through to the sick room, not wanting to do the schoolwork because it causes some anxiety or being at the classroom. So that is permissive way of handling this. Completely wrong method by the teacher. So you may think, okay, how does the teacher know this headache is not serious? Because she is not the doctor, but two specialist doctors have seen and clearly said, and she should ask from the parents, okay, may our doctor කෙනෙකුට පෙන්නවද? Yes, parents are doctors themselves, so there's no need to worry. So the teacher should not have sent her to the sick room. Should ask her to stay in the class. If you have severe difficulties, keep your head on the table, but remain in the class. And the grandmother is the most permissive person. ඔළුව කැක්කුම හොඳ වෙනකම් ගෙදර ඉන්න පුළුවන්. ගෙදර ඉන්නකොට මම orange juice හදලා, TV දාලා, Nickelodeon දාලා බබාව බලා ගන්න. So she will give unlimited options when the child is at home. So until the headache remains, the child does not have to go to the anxiety provoking situation at school. Because she's so comfortable at home. Because when you have what we call the anxious and avoidant temperament, like Sehansa, they avoid anxiety provoking situations. So this is called classical anxious and avoidant temperament. So that is the diagnosis of Sehansa. So when you have anxious and avoidant temperament, you feel anxious for small things. අනිත් ළමයි බය වෙන්නේ නැති චූටි දේවල් වලට ඉක්මනට ස්ට්‍රෙස් වෙනවා. exam ලං වෙනකොට teacher project එකක් කරන්න කිව්වහම anxious. When you are anxious, stress hormone release, you present with frontal headache and upper abdominal pain. Then, when the grandmother says, කැක්කුම හොඳ නිකන් ඉස්කෝලේ යන්න එපා, avoidant behavior. How you deal with anxiety does not go and learn coping skills, but stay at home. Avoid the anxiety-provoking situation. So you can see how the permissive parenting approach has severely damaged this child's future by maintaining this avoidant coping style. So what are the four parenting types? Authoritative, authoritarian, permissive, and uninvolved parents. So authoritative parents are the best. Let's first talk about wrong parenting style. Authoritarian parents have high expectations and high demands, but they do not provide emotional support. They will say, ඔයාට අපි ඉල්ලන හැමදේම අරන් දීලා තියෙනවා. ඇඳුම්, පොත්, හොඳ ඉස්කෝලයක් ඔයාට තියෙන්නේ ඉගෙන ගන්න විතරයි. Authoritarian parents. So they have high expectations but lack emotional support, which creates what we call fear of failure. ඔයාට ඔක්කොම දීලා තියෙන ඔයා මේ level එකට යන්න වැටෙන්න බෑ. So if the child falls, the child is in the fear that he or she may disappoint the parent. So that creates what we call the fear of failure. When you have fear of failure, you don't want to do innovative work. You just want to carry on what the system demands. When we go to a government office, ලියුම් 7ක් ගේන්න එපා 6යිනේ ගෙනල්ලා තියෙන්නේ අද වැඩේ කරන්න බෑ. ඔයා ආයෙ අම්පාරට ගිහිල්ලා ආයෙ දවසක එන්න. So that is can't go beyond the framework. You are stuck in the system, existing system. Permissive parents like Sehansa's mother, father, and grandmother, they are too friendly with the child. They consider themselves to be friends, not parents. So in the clinic, sometimes mothers come to the clinic, they come and say, Doctor, mama me baba ගැන කියන්න ආවේ. එයා ඉස්සරහා කියන්න බෑ. යාට අප්සෙට් යනවනේ. ඒකයි මං කියන්න ආවේ. යාට හරියට තරහ යනවා. මට ගහනවා. Okay, so I imagine she's talking about a 18-year-old, 100 kilogram weight boy who has very muscular and strong. No, she's talking about a 6-year-old tiny girl. So the child holds the power at home, and being bossy, permissive parents do not keep emotional boundaries. So they are very permissive. Child controls what they want. Whenever child wants something, they will give that. Whenever child cries, they will try to comfort the child. And uninvolved parents are completely neglectful of the child. They do not care for the child, and the child grows up by himself without emotional validation. So authoritative parents are the best approach. They have expectations. ඔයා මේ පාර ගණන් වලට 65යි. Next time you have to get 75. But if you get 73, we will still be proud of you, but we will provide support if you fail. So there are expectations. There are very clear rules. But if you fail, we will still support you. So that is the best parenting style. So if you have authoritative parents, you tend to develop good self-esteem, capable and efficient. If you have authoritarian parents, you are highly efficient. You turn up on time, but you don't enjoy life because you lack self-esteem. Permissive parents, you don't have good self-control because parents provided you with everything. When you are older, you need all the time, your hand goes to your smartphone. You always time feel bored and you want to go through social media, post selfies, want others to like your picture and want to be liked. If you have uninvolved parents, the parents do not give emotional validation, so you are not proud of yourself and you don't know yourself. So you feel lost. So how to be authoritative parents? Have clear rules. If the rules are not met, there should be consequences. Right? අම්මිගේ ෆෝන් එක ඔයාට දෙන්නම් 6:30 to 7. 7 වෙනකන් 7 වලට දෙන්න ඕන. Now it's 7:01. You have exceeded 1 minute. No phone for 3 days. Very clear rules. Next day, child says, "අනේ අම්මි චුට්ටකට ෆෝන් එක දෙන්න." No, no, no. The rules are very clear. And if the child fails or gets low marks, always there is emotional support and validation. So sometimes in the same family, the two parents can be of completely different approaches. We will have such examples in the coming case exam. So permissive parents are friends. It's okay to be friendly with the child, but never okay to be friends with the child. So what does Sehansa have? A cluster C type of personality or temperament, a worrying, timid, anxious temperament where they avoid whenever there is slight uncomfortable nature in the situation. Iskole teacher චුට්ටක් තරයි ආමට යන්න බෑ ඔළුව එකක්. They are perfectionists in some areas of life. Remember, when children are perfectionists, they are not perfectionists in every time. Then sometimes we tell parents, your child has perfectionist traits. Parents say, එහෙම කියන්නේ කොහොමද? එයාගේ room එක හොඳටම අවුල් වෙලානේ. No, no, no. The perfectionism in this age is usually in handwriting. And they are dependent on others. They are emotionally dependent on the maternal grandmother or the mother to comfort them, even though they are already 7. So I think as a parent and a teacher, the most important skill you can give to a child is emotional awareness. So no other skill, not handwriting, not IT skills. I think the most important skill a person can give to a child is emotional awareness, because this is the first step of emotional intelligence. So to help Sehansa, the first thing we have to do is not reduce her anxiety, to tell her that she is anxious. How do we tell her that? By teaching emotional awareness. How do you teach a small child emotional awareness? By stories. For example, you say, there was a rabbit family. There was a bunny family. Bunny mom, bunny dad, and bunny kid went on a jungle stroll. While they are walking, they came across a huge river. The water was flowing, but because the bunny dad is super strong, he jumped over the river to the other side. Bunny mom ran very fast and she also crossed the river. Oh, the bunny kid is on this side of the river. Bunny parents are on the other side. Look at these pictures of emotions. Pick the emotion for the picture. Pick the picture that's most appropriate for the bunny, how the bunny kid is feeling. Baba me පින්තූර ටික බලලා එයාට ගැලපෙනම රූපේ තෝරන්න. So we show the emoticons, or we show the pictures with different emotions and let the child pick the relevant emotion. Then we continue the story. අමාරුවෙන් the bunny kid jumped over the river bravely and crossed over to the other side. Now, how will he feel? Pick the appropriate picture. So this is how we teach little kids emotional awareness. There are so many hundreds of methods like emotional thermometer we can teach teenage kids. So Sehansa, first step is emotional awareness. Second step is teaching relaxation technique. For 7-year-old, it's simply belly breathing. Sit straight on a chair. Keep your back straight. Don't let the back touch the chair. Keep your right hand or the dominant hand on the upper abdomen. Close your eyes. Take a deep breath from the nose. Slowly purse your lips and put the breath out, and observe how the hand moves. Do it for 2 minutes in the morning, 2 minutes in the afternoon. And keep sending her to school. Stop going from doctor to doctor and further investigations, and reassure the teacher to keep her at school, not send her to sick room at home. And reassure the parents that you need to get away from the school gate and go to your work. Right, let's move on to the second case. Right, please read the second case example and type what you think. Okay, what do you think? What is happening with Netula and what's the issue with Netula? Can you type in the Zoom chat? Very good. There's a comment. Mother subconsciously comparing Netula with her brother. Very good. Mother is worried that son will end up as her brother. Mother is afraid that Netula will turn up like her brother, so she's pressuring him unintentionally. Very good. Very good observation. Any other observation? So mother expect what she has gained from her child, so the Netula will go in the same path. Yes, good. Good. Netula observes his father and wants to be an easygoing person like his father. Yes. Father is more open-minded. Okay. Let's see. Let's go deep into this and see what's happening. And another comment, mother is having anancastic traits and authoritarian. Netula is comfortable with his father. The two parents are different, so Netula is confused. Yes, there are two different parenting styles. Very good observation. Absolutely correct. So Netula is 10 years old. Now he is in the concrete operational stage. He has moved on from the pre-operational stage and has some logical reason. So Netula is the only child of two doctors. Mother is methodical, punctual, and highly organized. So mother is anancastic. What we say, she works on time, punctual, and has high self-standard. So when you are an anancastic person, you have high self-standards and you impose those standards to your family members as well. වෙලාවට කෝල් එක ගන්න ඕනේ, වෙලාවට කාලා ඉවර කරන්න ඕනේ, වෙලාවට ලෑස්ති වෙන්න ඕනේ, දත් මදින්න බෑ උඩ බලා බලගෙන, lot of rules. However, father is not like that. He is relaxed and easygoing. When asked about special friends, Netula says he has one friend. So if you ask a 7-year-old, බබාට විශේෂ යාළුවෙක් ඉන්නවද? එහෙමම නෑ ඩොක්ටර් අංකල්. දෙතුන් දෙනෙක් ඉන්නවා I think සෙල්ලම් කරන. Perfect answer for a 7-year-old. But a 10-year-old in the concrete operational stage, they should have a special friend. It does not mean that special friend will consider this child to be their best friend. Doesn't matter. But there should be some special friends. So if they say, පන්තිය ඔක්කොම ඉතින් යාළුවෝ තමයි, that means they don't have friends. So if they have one friend, that means they are sticking to a similar child like them and not exploring elsewhere. So that means they are timid and maybe a bit anxious to start a conversation. This comes to Netula because mother has high self-standards because she's anancastic. Netula always feels he's not meeting Ammi's expectations. අම්මි හැම වෙලේම අකුරු රවුම් කරන්න කියනවා, ලස්සනට ලියන්න කියනවා, මට ඕවා කරන්න බෑනේ. So he lacks self confidence and self efficacy. මොකද හැමදාම ගෙදර බැනුම් තමයි. So හැමදාම ගෙදරදී අහගන්න වෙන්නේ මදි වැඩ, උනන්දුව මදි, කරනවා මදි. So එතකොට පන්තියේ යාළුවෙක් ඇති කරගන්නත් බෑ. ඉතින් මම මදිනේ. So lack self-esteem. So an anancastic mother and an easygoing child is the worst combination. At the child psychiatrist consultation, Netula holds his father's hand. Father is easygoing, maybe too easygoing, so he knows father is the safe space. No demands, no anxiety. He holds on to the father's command because he's meeting the child psychiatrist. He doesn't know the child psychiatrist. It's a stranger. It's anyway natural to feel anxious when you are meeting a stranger. No? So then he feels comfortable holding to the father's hand because the father is easygoing, no demand. Father's brother is an IT consultant and the mother's brother is a Uber driver. Even though the Uber driver may be earning more than doctors these days, still in our cultural connotations, Uber driver is maybe of lower standard in our cultural explanations. So the mother feels her brother is actually not doing well. According to the teacher, Netula makes many careless mistakes in writing, and while he writes, the mother has to sit close to him. After grade 2 in grade 3, after term 2 in grade 3, තුනවසර දෙවෙනි පාරෙන් පස්සේ, you don't have to sit close to your child. They are supposed to come home, pick the book relevant to homeworking, do it by themselves and put it back. If you have to sit close to them after second term of grade 3, that means there's something wrong. So you know, intelligence is one of the most heritable traits we have. So how come a kid of 2 doctors not doing well at school? Why? Because he has possibility of attention deficit disorder. That is why he can't meet expectations of mark. Not because he's not intelligent. He has attention deficit disorder or some writing deficit. So the mother can remember, where did this ADD genes came from? මල්ලිත් චූටි කාලේ ඔහොමනේ. එයාත් අකුරු ලියනකොට හරියට වරද්දනවා. මෙයාත් එහෙම තමයි. So unconsciously, she's unintentionally comparing her son to her brother. So her response is exaggerated. So this is what we call object relation, where object means an emotionally significant person in your past. Their memories stored in your unconscious mind. So when you react with a new person, object relations means you bring those experiences to your new relationship with your son. So her anger, her aggression to her son is exaggerated because of the unconscious, unresolved memory of her brother not doing well in her life, according to her standards. I'm not doing Uber drivers are not doing well, according to the cultural standard. Netula's mother entered a famous school on the scholarship and his uncle remained in the village school. So, according to Netula's Ammi, entering and getting through the scholarship is essential for successful, so-called successful life. But Netula's father doesn't feel like that. He learned from an elite school from the beginning. So he doesn't know these scholarships. Why do they have to work hard for them? Anyway, he has an easygoing personality. Father is not interested in the scholarship, and Netula's mother says, we do not pressurize Netula for the scholarship. දැන් ළඟ වාඩි වෙලා අකුරු ලියනකොට මදි කියලා බයිනවා. මේ කොල්ලා දැන් මුද්දටම බය වෙලා ඉන්නේ. යාළුවෙක්වත් දාගන්න බෑ. මොකද අම්මා බැනලා දැන් self esteem එක බිඳුවටම බහැලා තියෙන්නේ. හැබැයි අම්මා self psychiatrist අහපුවම කියනවා අනේ අපි නම් ශිෂ්‍යත්වයට ළමයව මහන්සි කරන්නේ නැහැ කියලා. What is this? This is psychodynamically, psychological, a defense mechanism, denial. Now she has a huge unconscious conflict. Brother didn't do well after not getting through the scholarship. My son has similar characteristics to my brother. So this comparison, this conflict leads to she can't accept and keep this distress always in her conscious mind. So what is that? අපි මහන්සි කරන්නේ නැහැ. So she's not lying. So now she copes by not letting her unconscious conflict getting into her conscious mind. යටිහිතේ තියෙන මල්ලි ගැන මල්ලිගේ ලක්ෂණ පුතාට තියෙන අරුබුදය උඩ හිතට එන එක වළක්වන්න තමයි මේ denial කියන defense mechanism එක use කරන්නේ. අපි මහන්සි කරන්නේ නැහැ. Right? So that is what is happening here. So ADHD is very common. 10% of Sri Lankan boys and 3% of girls have ADHD. ADHD has two variants. Hyperactivity variant, where especially boys get it. එහාට මෙහාට දුවනවා, එක තැනක ඉන්නේ, they are fidgety, they are over talkative, they disturb others. ලොකු දෙන්නෙක් කතා කරද්දි මැදට පැනලා කතා කරනවා. The girls mostly have the inattentive variant. They are not running around, they seated, ලොකු කලබලයක් නැහැ, but they make careless mistakes. So easily, when a boy or a girl has inattentive variant of ADHD, they are frequently missed. Teacher කියනවා ඩොක්ටර් කොහොමද එයාට ADHD තියෙනවා කියන්නේ? මෙයා hyperactive නෑනේ. එයා එක තැනකට වෙලා ඉන්නවානේ. කාටවත් ගහන්නේ නෑනේ. But when you look at the book, there are careless mistakes. So, Netula could be having inattentive type ADHD, which is missed by her parents. If it was treated, he would have met good school work. So what is ADHD or ADD, attention deficit disorder? We have what we call an attention span. A 10-year-old should sit for 20 minutes without getting up, looking around and do their work. So if their attention span is not 20 minutes, it's only 5 minutes, reading a book, understanding 2 paragraphs is super hard. After each 5 minutes, the neural network is reset and you lose track and you get distracted. So කියවන්න ලියන්න කියලා කියනකොට අයියෝ බෑ පස්සේ කරන්න. අනේ දැන් බෑ පස්සේ කරමු. Like that. Or they want to go to the washroom because they know keeping track of and reading is very hard. But looking at the smartphone, super easy because the smartphone screen changes every second. So it is inside the 5 minutes of attention span they have. So it's super comfortable space. They can watch phone or tab or laptop for hours. Or they can read a novel or make Lego for hours as well. Because when you are reading a story, the story keeps changing inside the attention span. So reading too many storybooks is also a feature of ADD. So what is ADD? It occurs due to norepinephrine inefficiency in the midbrain to cortical neural network. So if you take depression in a child, it's 50% psychological, 50% biological. You can say, right, බබාට depression එක තියෙනවා 150ක් ජාන වලින් 50ක් සමාජ මනෝ සමාජීය. ඒකින්ද මේකට cognitive behavior therapy කියන psychotherapy එකෙන් treat කරන්නත් පුළුවන්, antidepressants දෙන්නත් පුළුවන්. දෙකම කරන්නත් පුළුවන්. But ADD 90% neurobiological because it's a highly heritable thing. You cannot treat without medication. So what the NICE guideline says, less than 5 years, behavioral management, above 5 years, medications plus behavioral management. So the medications are super safe. They do not cause major side effects. And if there are minor side effects, you can obviously change the medication and go to another one. So we know a lot of medical students, engineers, doctors have had treatment for ADD and they are no longer taking treatment and they are doing very well. So what happens to these symptoms? Even though hyperactivity and impulsive anger goes down, inattention remains. එතකොට අම්මලා කියනවා මෙයා පොඩි කාලේ නම් හරිම දඟයි. චුට්ටක්වත් එක තැනක ඉන්නේ නැහැ. දැන් කොහමද? දැන් ටිකක් ලොකුයි. දැන් නම් දඟලන්නේ නැහැ. ලකුණු ගණන් වලට නම් හොඳයි. ඔය පාඩම් කරන විෂයන් තියෙන ඒවට ලකුණු අඩුයි. So what happens? Hyperactivity has resolved, but the inattention remains because until 15, 80% will improve by 15 years. Until that time, almost 2/3 will have some symptoms. So they ignore the child and didn't show for treatment when they were small. Now they are big. Now they are worried because there's a drop in the marks. Because they have a good IQ, they get good marks when they are small. 4 වසරේදී නම් හොඳට ලකුණු ගත්තා. Yes. Even though they have ADHD, they have good intelligence, so they get higher marks in small classes. Because even though they do not listen much, from the little things that they hear, they get good marks. But now in the bigger upper grades, now the curriculum is vast, cannot remember a lot of things, and they get low marks. So let's look at a video of kids. Sound right. So this is an animation, obviously, and not real people, but the voices in this video are real kids. The voices in this animation are from real kids who have ADHD.
So, what's it like to have ADHD?
Some people daydream or find it difficult to concentrate. Others feel angry. Sometimes I just want to go out and lashing out at them. It's like your heart starts, your body starts getting really rough and hot and all that. It's feel like it's really aggressive.
So he feels aggressive, like a human volcano.
Exactly.
But doesn't that mean he might be in trouble a lot or might feel bad about himself?
Yes, but some people with ADHD don't feel like that at all. Some daydream.
So do you feel like you can't pay attention very well?
Only when I'm taking a test. I get distracted, I'm like, then I'm off in my own little world.
What's it like in that world?
Fun. I get to draw, paint, do whatever I want.
And
I also get to buy my own dog.
it sounds like a lovely world. Why do you think it's a problem?
Because I don't get my work done.
So she was daydreaming, which sounds fun, but means she's not concentrating on her schoolwork.
Right, and focusing is a problem for some people, whether they daydream or not.
The worst problems I really have involves schoolwork and not being able to finish classwork before the other students. What they do in my math class is when we're done with a test, our teacher will ask us and she'll tell us to raise our hands if we're not finished, and sometimes I'll end up being the only one in the classroom and everyone will kind of stare at me.
So he struggles to concentrate. Whoa!
That's right. And some people feel like they're on the outside, that things are out of their control.
I say stuff that I don't even, know why I said that. And then a couple minutes, wow, did I just really do that? I can't believe I did that.
So ADHD can feel different to different people.
Yes, and that's why it's difficult to tell who has it.
Does medication turn me into a different person? So if I had ADHD, would I have to take medication?
Perhaps. You might have heard of one of them. Ritalin.
And how much would the medication change me?
Some people think it can change you a lot, even into a different person. But it's not actually like that.
Okay, so would the medication give me space to stop and think?
That's a nice way of putting it.
Would you say that when you take your medicine, it changes you?
It's a bit of both really, because I'm a bit the same person I always am. I act a bit different, but I am always the same person.
No, I'm still the person I am, yeah. Just almost a better version. Well, I don't think they'd be better, but they just remind that part of my brain to work. That bit's already there, but then that just reminds it to do its job.
But it's not that different. You're still the same person, but you just act a little better. Medication will help you control yourself.
When you take your tablets, because do you feel like you're a different person?
Well, not really. Yeah. No, it's just I'm the same person. It's just I just behave differently.
So the medication wouldn't turn me into a different person?
Exactly! It's tricky for children with ADHD because they have to learn to follow the rules, but they also want to be free, to be themselves.
Sounds like a difficult balance.
It is. That's why kids need lots of support when taking medication, so they feel they can be themselves. And doctors and parents can help by talking about it with them.
What does Ritalin do? So what exactly does Ritalin do?
It affects certain chemicals in the brain and can help control some of the symptoms of ADHD.
Is that a good thing? Can that really help?
It helps people in different ways. It can help them to focus, to control their attention, and it can help them to stop and think before they act.
Well, some people have ADHD and they're like my mate who has got it, he's got severe and he's always hypo, even when he's took his tablet, but he's a lot calmer when he's took them. It makes me helps me behave better, but it don't make you behave better. Can only help you, but it can help make better decisions.
So what does the medication do? What does it do? It gives you space. So when you are faced with danger or a threat, like someone bullying you, it gives you space before you react. It actually does not change your character strength or personality traits, It just gives you space before you react. So when there is space, you can think about the consequences before you get into a fight or an argument.
So, what?
So what should we do when a child has these kind of inattentive habits? Catch them when they are doing good and praise them and smile with them. When you give an instructions, go to their level, touch their shoulder, give a little tap, and tell it in simple language, one instruction at a time. When they complete stuff, praise them and give rewards and have a system of a reward scheme. මේ ටික කරොත් ගෙදර ඇවිල්ලා wash එකක් දාලා බත් ටික කාලා homework කරොත් පැය භාගයක් cartoon බලන්න පුළුවන්. And when they do not follow rules, have consequences. අය හමාරට නවත්තන්න කිව්වනේ දැන් 6:35. හෙටයි අනිද්දායි ෆෝන් එක ලැබෙන්නේ නැහැ. So always have consequences. Also, Netula, we discussed in the example, also could be having something like this in the future, where he is good in most of the language or humanistic subjects, not so good in calculation and mathematics. Sometimes Netula could be having also a specific learning disorder or known as dyslexia. It could be problem with reading, it could be a problem with spellings, or it could be problem with calculation. So specific learning disorders are super common. 10% of all kids have a specific learning disorder. So it could be attention deficit disorder or it could be a specific learning disorder. So why does specific learning disorders occur? Because there's incoordination between auditory processing, motor auditory, and occipital lobe areas related to reading a letter. So if there's incoordination between these three areas, it could lead to a specific learning disorder. So when you have a specific learning disorder, when you make the same writing or reading mistake again and again, you need to have Autumn-Gillingham approach or multisensory therapy via educational therapy to get better, and they can be easily treated if they are presented in grade 1 or 2. Right. So let's go to the last example to save time. I will straight away go to the discussion. Please read this example. Okay. So Himashi is 15 years of age. So she is in the middle adolescent. So in the middle adolescent from 13 to 16 years is where we develop the self-identity. For the first time in life, we move away our identity from our family and try to create who we are. That is the time girls wear little bit of different styles of clothes. Boys do crazy hairstyles or wear tight pants. So teenagers seeking who they are. So when a teenager texts, I hate myself, I want to die, it doesn't mean they want to die. It means they are distressed and they are seeking support. However, what happens when the mother found out? Mother panicked. So the next time they have a thought like that, they are not going to tell their mom. Because Himashi knows if I tell that I have a thought of killing myself to my mom, she's either going to scold me or she's going to get panicked. So what I'm going to do, I'm going to tell this to a friend. The mother is always with the conflict with Himashi, but the father have no conflict. Does that mean the father is good? No, the father is emotionally uninvolved. So because the father is uninvolved, the child seeks an emotional father figure in someone else. 15-year-old getting in a relationship with a 22-year-old with a 7-year gap. Okay, a 30-year-old woman in a 37-year-old man, I have no issue. But 15 years to 22 years means there's a huge transition of personality traits. It's like a medical student getting into a relationship with a consultant. So there's vast emotional maturity differences. So why is she getting into a relationship with the older person? His emotional father figure is missing in her object relations, in her unconscious mind. She needs to comfort and get approval from an older male. And father is quite busy and he thinks, මේ හිමාසික ප්‍රශ්න ඔයා විසඳන්න. මට ඔයාට busy ආපෝ ගොඩක් on call තියෙනවා ඔයා බලන්න වෙලාවක් නැහැ. ඔයා ওই ටික විසඳන්න හොඳේ. So he is uninvolved. So he just rewards Himashi with monetary things like buying her expensive phones, laptops or something like that. So father is never violent to Himashi, but he has been violent to Himashi's mom. So there has been violence in the home environment. So Himashi is not afraid of father, but he has seen violence and conflicts between them, which has traumatized her, and she feels alone and helpless. So how does she cope with herself? She likes BTS, a famous, a global phenomena, music boy band from South Korea. So she listens to their songs and try to comfort herself. And the mother thinks, so she's trying to comfort herself by listening to songs and reading lyrics of BTS, but the mother is blaming her. මේ ළමයා හැම වෙලේම phone එකේ. So a lot of parents whose teenagers are always on the phone, මේ ළමයා හැම වෙලේම phone එක බලනවා, thinks all the other teenagers are like that. Not at all. If the teenager is always on the phone, there is something wrong with it. It's not the normality. So what is the wrong? Himashi is feeling helpless, scared and lonely. He is trying to seek for help. Himashi is quite intelligent. Because she is not studying very well, she only gets average grades. But actually if she did well, she would get brilliant grades. Mother has tried her best. So she has taken an authoritarian role. The mother has taken an authoritarian role, I think. Father is completely uninvolved. So she has to carry Himashi's burden by herself. So she has been an authoritarian parent carrying Himashi's behavior for a long time. Now she is frustrated, sad, and feeling depressed. So she shows initial symptoms of depression with delayed sleep and irritability. However, father continues to be uninvolved. He's like a Linde in an idea psychiatrist at a pen unknown. Like that, he sees nothing serious and he postpones getting professional opinion by showing to adult psychiatrist. Because what will happen if the mother is not treated by a psychiatrist, the depression will worsen and it will come with complications like inattention, anger, violence, and maybe suicidal ideation and violence towards Himashi as well. So let's look at the main problem here for the parents: screen addiction or high screen use. Usually in Sri Lankan teenagers, 5 reasons lead to screen addiction. First thing is permissive parenting, where the parents are of 2 parenting style, or there's a permissive grandparent or a permissive parent. They do not keep clear boundaries. අයින්දලා 7 වෙනකම් ෆෝන් එක පාවිච්චි කරලා දෙන්න 7ට අනේ අම්මි තව 10 minutes කමන්නේ. So there are no clear boundaries. Permissive parents who are basically friends, not parents. Poor coping skills. Going on a long journey on the road, feeling bored. අම්මි ෆෝන් එක දෙන්නකෝ හරි boring නේ. They don't have skills to relieve their boredom by themselves. So they always seek devices to relieve their boredom. They have been not taught age-appropriate coping skills. Impulsive temperament, where you want to seek new things. You are a novelty seeker. You want to seek new things. YouTube video after video, go from link to link. So they want to seek new things very quickly. Peer influence. පන්ති අනිත් හැමෝටම ෆෝන් තියෙනවා මට විතරයි නැත්තේ. There are plenty of kids who don't have phones. They easily influenced by kids who have screens or devices. So they demand. So they keep demanding because they have poor frustration tolerance. And teen depression. When a teenager is depressed, they feel empty. When they feel empty, they will try to fill that emptiness by quick relief through a screen. So how do we recognize teen depression? This is the normal mood variation of an adult. We feel happy when we see our kids. We feel sad, distressed when we see our number of clinic patients. But our mood variability is close to the baseline. But in a teenager, the normal mood variability is very high. They feel happy when someone has seen and read their message. They feel super sad when they are asked to study and stop watching the cricket match. When an adult is depressed, that low variability is seen even when the mood is low. Still low variability. However, when a teenager is depressed, the mood goes down, but the variability is very high. So you may see them in these peaks and think they are not depressed. Sometimes when we say, පුතාට ටිකක් ඩිප්‍රෙෂන් එක වගේ ડોක්ටර් කොහොමද කියන්නේ මගේ පුතාට ඩිප්‍රෙෂන් කියලා එයා මේ දැන් 30කට කලින් chat කර කර hina වෙවි හිටියේ. So when you see them in these peaks, you may think that they are not depressed. What are the commonest features of teenage depression? Anger, irritability, arguments, lack of concentration, and lack of motivation for study. So if a teen is depressed, there are two ways to treat that. The prefrontal cortex is less active, so that is why they can't concentrate. They do not motivate themselves, do not have the energy to study. So you do cognitive behavior therapy to activate the prefrontal cortex. The amygdala is too active. Punchi deetat andanawa distress easily. So you give antidepressants to calm the amygdala and make them cope with their daily stresses. So to end the session, I would like to point out that I would like to thank my college, Sri Lanka College of Child and Adolescent Psychiatrists, for supporting me. And these are the hospitals where child and adolescent psychiatrists work in Sri Lanka: Leybridgeway Hospital, Kalubowila, Karapitiya, Angoda, Ragama, Anuradhapura, and Peradeniya. And we have child psychiatrists in the university system as well. However, almost all adult psychiatrists working in the country have dedicated child psychiatric clinics, especially on Saturdays. And if a child psychiatrist is not available in the area you work, you can refer to an adult psychiatrist for opinion. So if you are interested in child mental health related material, you can like our Sri Lanka College of Child and Adolescent Psychiatrists Facebook page, and we post interviews, webinars every week. So thank you for listening. I am interested in any question you have to ask, and thank you for joining today.
Thank you very much, sir, for that very informative lecture. And we have received some questions, and since the time is limited, that we will look into some of the questions, and the rest of the questions will be answered by the presenter personally. And the first question is the approaches we can take to make the kids more independent from early childhood.
So making a child independent is, first thing is, you have to feel independent. That means you have to take a risk. For example, when you ask your child to make tea by him or herself, there is always the risk. Will they burn themselves due to hot water? Still, you have to take a risk, and you have to understand whether you are emotionally over-involved with your child. If you think, වැටෙන්න දෙන්නේ, වැස්සට යන්න දෙන්නේ, වැලිය අත ගන්න දෙන්නේ from a younger age, you are being too involved, and that can lead to less independence in the child. So let's say they are in grade 3, 8-year-old. Now they are going to go to school. They have, let's say, maths in the afternoon. But when they are leaving and getting to the school van, you can see their math book on their table. They have forgotten it. You should never tell them that they have forgotten the math books. Let them deal with their incompetency and face the consequences by themselves. So when you allow them to do that, yes, they are going to be distressed. They may be punished by the teacher. You have to bear the consequences as well. So let them have some risk depending on the circumstances and make them independent.
Thank you, sir. The next question is how to deal with my own anger when the kid makes a mistake and that make me angry.
Very good question. So the technique we usually tell Sri Lankan parents is called the emotional thermometer technique. Emotional thermometer technique. උෂ්ණත්වමානයක් ඔළුවේ උෂ්ණත්වමානයක් තියනවා කියලා හිතන්න. Think there's a thermometer in your mind. If it's red and you are working with the child, මේ දැන් කියලා දුන්නානේ කො හරියට ලියන්න. You are angry with yourself. The emotional thermometer is in the red color. Stop what you are doing. Go drink a glass of water, take some breath in, relax yourself and come back and try to teach your child. If you think emotional thermometer is in the green side and still the child is not doing work, find a different strategy. Teaching this technique or writing in this way is not working. Let's go to a different technique. So you know, children are mainly kinesthetic learners. Rather than writing on a paper, maybe writing on a valipillava, a small pad with sand, or using a pencil with a bigger diameter, or making letters out of clay. Rather than writing letters, making letters out of clay or cutting a letter out of cardboard may be more easily understood by a little kid. So that may be the reason that their perception of letters in the 3D form has errors. If you can't keep up, seek expert opinion.
Thank you, sir. And the time is running out, and we are receiving many questions regarding this topic, sir. And we'll be able to answer those questions and send it to the audience later. So we'll conclude the sessions, and our sincere thanks to Professor Miyuru Chandradasa for his excellent lecture and the precious time. And I would like to thank the audience for participating in this webinar. And please find the link in the chat box. Kindly give your feedback, answer the post-assessment questions to receive your e-certificate for participation. We hope you had a productive session today, and we invite you again to next week for another interactive and timely topic in our Shri webinar series. Once again, thank you very much, sir, to share the knowledge with us. And thank you very much for the audience. Thank you.